Hello and welcome to the Connected Community Podcast. Today, I have my absolute favorite guest in the whole wide world, Adam Yazbeck, my amazing husband. And today we talk about the science behind psychedelics. Adam and I are very passionate about this topic, but Adam has a beautiful way of doing tons and tons and tons of research, gathering lots of data, and is able to understand it and explain it in a way that is easy for us to understand and to digest, which I really appreciate. So today we talk about what happens to the brain under psychedelics, why psychedelics help heal our physical and our emotional selves, how it is similar to the process of using therapy and mindfulness and meditation and other practices like that. You're going to love this. It is so good. It's full of so much information. And please, if you do, take a moment to give us a like, a share, and a subscribe. And I'm going to hop on in with Adam. I hope you'll enjoy. Hello, and welcome to the Connected Community Podcast, a place to explore possibility through mindfulness, movement, and self-discovery. Our intention is to deliver insight and inspiration while fostering conversations that are genuine, unfiltered, and deeply human. We hope you will enjoy today's episode. Hello, Adam Yazbeck. Welcome to the Connected Community Podcast, or welcome back to the Connected Community Podcast.
Thanks for having me.
Yeah. All right. I'm excited to dive into our topic today. We're going to talk about the science of psychedelics and how they affect the brain. Before we dive into that piece, let's just introduce you and tell people like who you are and why this is a fascinating topic for you and why you know so much about it. And then a side note, of course, you're my amazing husband. And I really love the way that you pull information apart and make it really easily digestible for the layperson or somebody that's not super science-based. And so I love that. And let's start with your credentials, your background, how you got to where you are now.
Yeah, so my first career was in theater as an actor. I did Shakespeare and classical theater for about 7 years professionally. Went back to school for nursing, did that in pediatric emergency medicine for about 5 years, and then went back for my pediatric nurse practitioner acute care license, and I've been in the PICU for the last almost 8 years now. And I'm now currently back in school about a year from graduating from my psych mental health NP program, with a passion to work with people in the healthcare field, work with people with trauma, work with people in more of like a holistic way where we're melding spirituality and deep psychological work with physiology and medicine and neuroscience. And so psychedelics are kind of that perfect gateway into the territory sort of between all of those different things. And so we'll kind of talk about that today, why I'm so passionate about that and where that fits in this sort of model of molding together both science and spirituality.
Yeah. What I love about this is that 10 years ago, the topic of psychedelics was super taboo and people wouldn't talk about it, especially in the medical field. And now, I mean, you just presented to a whole huge group of nurses and providers. And so now it's not. And there's neuroscientists that are sharing this information, and there's so much data backing up why psychedelics are helpful therapeutic modalities. And so I'm really excited because we all know, well, we don't all know it works, but we know it works, but we don't know why it works. And so you're going to break that down for us today. So dive on in.
Okay. I'll try not to be too geeky because I think one of the things I've inherited from being in the ICU is I really love physiology. I really love to get into like the nitty gritty of how things work on a cellular level and like a neurochemical level. So I can go too far in that direction, so you just pull me back if I move straight too far.
Back to the layperson over here.
Yeah. I think one of the things I want to start with is kind of is contained within what the word psychedelic or entheogens or entheogenic substances, what those words mean. So I think the etymology of those words really speaks to what the nature of these different medicines, medications, what they do for us.
Mm-hmm.
And so the term psychedelic, actually, psyche in Greek also means soul, not just mind. And so it comes from this combination of the word psyche and delum, which is to be revealing or manifesting. So psychedelic is a soul revealing, or what they call a mind manifesting substance.
Mm-hmm.
And as we get into like the neuroscience behind that, it'll become very clear why that is the name that we give these substances.
Mm-hmm.
And then the other term that we use for classic psychedelics is entheogens, which is a combination of the words for within, God, and to generate. So literally, it means to generate the divine from within.
Mm-hmm. Yeah.
And so I think what that speaks to is really the types of experiences that psychedelics give us is this idea of like union with God or union with spirit, the soul. We have these experiences where we lose what we consider our self and really kind of experience this boundlessness of self. There's actually a term that they use called oceanic boundlessness.
Mm-hmm.
It's part of this altered states of consciousness scale that they're using in a lot of the literature to kind of objectively measure these subjective experiences. And so what they have actually found, which is super cool, is that the greater amount of disillusion of self, the more one kind of melds into the collective oneness of
Mm-hmm.
what's around them, the more that reflects in both their emotional well-being and psychological well-being on the other
Mm-hmm.
skills that they use to measure like depression, anxiety, all those different things. And so
Mm-hmm.
there is definitely this connection between spirit, soul, and physical and mental well-being, and
Mm-hmm.
psychedelics are kind of bridging that gap.
I keep having this image of when I was growing up, and it was like, this is your brain, and this is your brain on drugs. And it was a picture of an egg in a frying pan. And I think a lot of drugs do that, especially Western medications do that. But from what I've been learning from you is that these psychedelics repattern our brain in a really beautiful way. So they're healing our body, our mind, our spirit. They're healing our brain. They're creating these new pathways so that we live life differently. But I know a lot of people in my generation have this image of, this is your brain on drugs.
Yeah, so the Johnny Depp commercial of the frying egg and butter or
Mm-hmm.
oil or whatever he did it in
Mm-hmm.
is what we all grew up with, right? It was going to fry our brain. Um, it's really interesting. They did functional MRIs, which is basically like a magnetic resonance imaging scanner that looks at like the brain in real time. So they
Mm-hmm.
actually do studies where they look at the activity of the brain. And so it'll actually register what's like what parts of the brain are lighting up under substances. They call those functional MRIs. And
Mm-hmm.
so a lot of the new literature is looking at functional MRI imaging with people who are on psychedelics. They've also looked at people in functional MRI machines who are in like deep states of meditation, shamanic states of consciousness, all these different altered states of being. And what they're really starting to explore and discover is what's actually happening from a biological standpoint when we enter these altered states of being. And so the way the brain actually looks on drugs is like if you took an image and you just like splattered like all this like paint and everything just lit up. That's what
Mm-hmm.
actually happens to a brain when they're on classic psychedelics.
Yeah.
And so the mechanism behind that has to do with the fact that all classic psychedelics activate our 5-HT2A receptors. So that's a serotonin receptor in the brain that is excitatory.
Mm-hmm.
And so by activating that, we flood the brain with glutamate, which is the main excitatory neurotransmitter in the brain. And what it does is it just turns everything on at the same time.
Yeah. Yeah. I've
So,
seen that
yeah.
with your images where you're like a normal brain or, a normal resting brain. And
Yeah.
then one that's on psychedelics and it's all lit up. But why is that important? Why do we want all these different parts of the brain to light up? Why is that something to achieve?
Yeah, so it really comes down. So a lot of the stuff that we're going to talk about today is largely theoretical. Like everything in the brain, like we don't know exactly what's going on, but we see patterns and we see it correlate to different people's experiences, and we're able to kind of map areas of the brain that are more active in different like mental states or different kind of ways of thinking and behaving. And so what they've been able to kind of isolate is that there are these networks of the brain. So let's just start with what a neural network is.
Mm-hmm.
A network in the brain is basically different areas or neurons
Mm-hmm.
that fire and wire together. Okay. So those that fire together wire together. That's what they say with neurobiology. And so what we have at rest is what we call the default mode network. So this is the areas of the brain or the neural networks in the brain that are lit up when someone is in an awake resting state. So not doing anything actively, not imagining anything, not performing a task. This is just our like baseline.
Right.
It's like the brain at rest.
Mm-hmm.
And so what they're beginning to discover now is that a lot of the things that we see in psychopathology, like depression, anxiety, issues with ADHD, issues with like PTSD, even some stuff with like bipolar depression, even areas like concerning for schizophrenia, a lot of these mental health diagnoses that we are talking about have a certain pattern in the default mode network. And so largely what mostly is occurring is that there is excessive connectivity within the network itself, and there's a rigidity or kind of almost like a static state of the default mode network where it's not actually communicating with other areas of the brain that might be more adaptive or might actually provide healthy perspective or give someone the ability to think outside of their current very narrow box that they're in.
Okay. I'm picturing somebody stuck in a rut, or like a car that keeps going down the same road and then that keeps putting deeper tire marks into the dirt. And then once you've done that path so many times, you can't even see the other paths because you're just used to that path.
Yeah. And so there are these two kind of major areas of the default mode network, and they're both in the cortex. One's in the anterior portion of the cortex, they call the ACC, or the anterior cingulate cortex, and then the PCC, the posterior cingulate cortex. And these two main areas of the brain have very specific functions, which we can get into as we dive deeper. But essentially, they are the way that we reference who we think we are. So the idea of like, who is Nicky? That is something contained within the networks of your brain that are lit up when you're at rest.
Mm-hmm.
And so it's this like self-referential processing. It's how you access your history. So the narrative of your life, story that you've created about who you are and why you are who you are is contained in this posterior portion of your default mode network. And so when you think about someone who has like rigid self-belief or like rigid negative cognitions,
Yeah.
they may only see the world in a very specific, very static way that is negative, or that has a lot of ruminations, a lot of like predetermined conclusions about how someone might react to them or how something's going to go, because they're basing what's going to happen in the future off of what their past experiences have been. We see this a lot with like depression, anxiety, right? Like people have already decided what the future is going to be based on what's happened to them in their life. And they have a very rigid belief of that, and they have a really difficult time letting go of it. So therapy can help with sort of creating new neural pathways. There's a lot of studies now on ketamine and looking at how ketamine increases this neuroplasticity to think outside of kind of what is normal. But in reality, every psychedelic, any classic psychedelic, actually achieves the same thing where these areas of the brain, instead of staying linked to each other in such a rigid fashion, as everything lights up, they then connect to all these other areas of the brain that have been laying dormant. And then we have greater access to a wider perspective, a lack of a sense of self. Our ability to see ourselves in a different way begins to rapidly change in a psychedelic experience.
Yeah. So therapy can do it. So why wouldn't somebody just do therapy? Why? And we're not advocating here for psychedelics. So that's not the purpose of the podcast. We're really talking about the science behind it and what happens to our brain. But I'm assuming that people are going to hear this and say, well, I can just like skip all the therapy and I can just jump to psychedelics because maybe more of my brain lights up and that's what I want and I don't need therapy. So I'd love for you to touch on that.
Yeah. And so some of the studies that are out right now about psychedelics are comparing them to SSRIs, which is the standard of care for most depression, anxiety, are on either SSRIs or SNRIs. And so the kind of the hallmark study by Robin Carhart Harris looks at the difference between Lexapro, which is one of our like mainstay SSRIs, and psilocybin. And what they found is the effects for psilocybin were actually bigger than the patients who were just on an SSRI. So they looked at 3 weeks, 12 weeks. I think they even did a little bit further out and looked at the results of remission
Mm-hmm.
and improvement in depression scales. And two macro dose psilocybin journeys were more effective than being on Lexapro for that same period of time.
Mm.
And so I think what we're starting to see is that there's a component to psychedelics where the neuroplasticity is really this opportunity to build new neural connections and new neural pathways. And you can also do that through therapy. However, that does take considerable time often.
Mm-hmm.
Um, and like anything with medications, we're always augmenting that with therapy. So even if you were to go see a provider and they would prescribe you an SSRI for your depression, everyone should also be recommending therapy at the same time because they work in conjunction with each other.
Mm-hmm.
Um, you can't just do one in isolation from the other. And so when we talk about psychedelics, what we're really starting to talk about is this idea of integration and how important that is for actually cementing these new neural pathways and to create kind of more adaptive and more flexible ways of seeing the world and how one sees themselves and how one goes about their day to day. So I
Mm-hmm.
do think it's this combination it's not like it's a magic pill. I think
Yeah.
most of Western society, we want to just take a pill to make us better. And I think
Mm-hmm.
when we approach psychedelics as this magic cure
Yeah.
for how we are living our life or how we think about ourselves or what things that have happened to us, we fall in that same trap of wanting a medicine to do something for us rather than using it as a tool towards wellness.
Mm-hmm. I'm assuming some people are going to hear this podcast and they're going to say, "Oh, that's awesome. Like I can just do tons of mushrooms and I can do some MDMA and I can do all these drugs and it'll light up my brain and I'm going to be healed." And we are talking about therapeutically taking psychedelics. And so what is the difference? What is the difference between doing a therapeutic dose and having a therapeutic journey on a psychedelic versus going to a concert and taking a bunch of mushrooms or sitting at home and doing some MDMA with some friends? Because there is a difference. And I don't want this podcast to sound like, yeah, go out and do a bunch of psychedelics. It's going to light up your brain and you're going to be healed, because that's not exactly what we're talking about here.
Yeah, so there's actually been studies that have been looking at the differences between different psychedelics. And I think one of the things that's coming out as a persistent theme in the literature is that ayahuasca works a little bit differently than some of the other psychedelics because it is such an inward journey. And what they're beginning to discover is that that inward process, that like kind of almost over rumination on what's happening and oversensitivity to what's happening internally is creating this process where we're starting to link things up in a different way. And we're starting to actually reprocess things that have happened to us and doing the work that you do in therapy. So there's this model called the adaptive information processing model. It's basically the model that is used to describe how someone experiences trauma, how it's stored in the brain, and how someone has to go through this process of reactivating and then reprocessing what they call pathogenic memory in order to link it up to adaptive networks. And so the beauty of what happens in a psychedelic space is that this sort of naturally occurs. And we can kind of dive into that in more depth here in a minute. But um, what I guess I'm sort of suggesting is that when someone is entering a therapeutic space with psychedelics, there's this inward focus
Mm.
that does that same process as one does when they're in like a very deep therapeutic process, either with like EMDR or IFS or like psychodynamic depth psychology or something where they're actually looking at their internal state and really focusing on what's happening emotionally, physically, mentally, and starting to work with that in more adaptive and maybe novel ways. And so,
Mm-hmm.
ayahuasca is one of those medicines that's actually very deeply internal. And they've actually started to discover that that's actually part of why it works so well. And so doing
Mm.
a bunch of mushrooms and going out to Red Rocks to go see a concert, they talk about set and setting.
Mm-hmm.
Your focus is external,
Yeah.
right? You're being social, you're enjoying something, you're taking stimuli in, you're not working with what's happening on the inside. And
Mm-hmm.
so it's that internal focus that is actually really what's doing the work. And
Yeah.
the psychedelics are just the vehicle to begin that process.
Yeah. And the intention with some of these bigger journeys in a therapeutic modality is, I'm going in with this intention to heal this or to look at this or to explore this, versus I'm just going to take this, I'm going to feel good.
Yeah, and I think starting to come up in some of the literature, especially about MDMA, that's starting to come up more with ketamine, is that what psychedelics allow us to do is to work with these really big kind of defensive or protector parts that don't usually let us get to the trauma because they
Mhm.
are so triggered. They get so overstimulated. It's not a safe space to go back in and reactivate something.
Mhm.
um, MDMA specifically, and ketamine as well, because it's a dissociative, allows people to go into these spaces that are really tender,
Mhm.
that are really activating, and be slightly removed from them, so they can begin to reprocess really traumatic experiences. And so, as a vehicle to doing the actual work, I think they're very powerful tools. But I think one thing I want to stress here is that taking the psychedelics isn't the work itself.
Mm-mm. Yeah. It's like a it gives you a window into the inside of your soul so that you can see what needs to be cleared out and what needs to be worked on. It just gives you that opportunity and that glimpse.
Yeah, I think it allows you to see yourself in a way that you don't normally perceive yourself. And so this actually speaks directly to what's happening to the default mode network, where your consciousness begins to shift from being individualistic
Mhm.
to collective.
Mhm.
And that is that oceanic boundlessness that they're talking about, that sense of ego dissolution, where you lose what you define as self and you begin to allow other things in your experience, other stimuli, to inform the way in which you see yourself. And
Mhm.
often that results in this feeling of like love, of openness, of connection. um, what actually ends up happening is there's this decoupling between that posterior part of your default mode network and your anterior portion. And when that happens under psychedelics, the anterior portion actually gets more activated, and that actually increases empathy. It increases your emotional processing. It makes you way more responsive and aware of your environment. It affects your visual cortex, so you start to see things differently. This is where hallucinations come from.
Mhm.
And even if you're not hallucinating, um, you're appreciating something in a way that you don't normally appreciate. So maybe the
Mhm.
light going through the leaf and the veins in the leaf are just so beautiful, and you can actually appreciate it for what it is.
Mhm.
And maybe you just pass by and look at a tree, you never actually give it a second thought. But in that psychedelic experience, you're appreciating nature, you're appreciating everything in your environment in a way that is really about being present. Um, and so it almost like not slows you down, but it increases your sensitivity to actually see things as they are.
Mm.
And so most of the time, our brains are filtering out information and making decisions about what's important to focus on, what's not worth my attention. And we have to do that because if we don't, we get overstimulated. So this is what actually ADHD is. ADHD is this inability to filter out what's important and what's not important. And so everything is so floods us, it becomes so overstimulating that we can't focus on what's actually the thing that we're trying to pay attention to.
Yeah.
And so psychedelics, in a way, actually kind of pump that up even more, where we can actually be present with everything that's in our environment, everything that's in our sensory experience. And this is also just not visual, this is emotional, this is physical, this is sensations. We get an experience of our body that we don't normally have. Things happen that we don't understand. And
Mhm.
it's about kind of turning off that cognitive part of our brain and listening to other parts of us that have things to offer, right? The
Mhm.
wisdom of our body, all these different sensory and intuitive experiences that are always there that we just don't normally pay attention to.
So how do we know when we are using just the right amount or we're using too much or it's starting to move into a place of addiction?
That's a really good question. And it's going to be different for everybody, I think. My model for this is the same thing as the way I look at like meditation or any kind of tool that we're using to kind of work on ourselves.
Mhm.
When the tool becomes a trap, right? When we have to use something to get to the place that we're trying to go, then we fall into the trap of whatever that tool is. So like if meditation is the only way that we can feel connected to ourselves and we feel all zen when we're sitting on a meditation pillow and everything's beautiful, and then 2 seconds later we yell at our child or we yell at our spouse or we're a dick at work or, you know, all of these things that aren't us acting in our best versions of ourselves, then it's not working, right? Like the tool isn't working. And we've fallen into this trap of thinking that we're all centered and enlightened and grounded and all these things when we're experiencing something, but it's not actually filtering into our life. It's not integrating into our everyday and the way that we are as a human being, moment to moment. And so I think if psychedelics become that trap where, you know, we go and we have a psilocybin journey and all of a sudden we're one with God and everything's amazing and beautiful and we love the world and we love everybody. And then the next day we're, you know, disconnected from ourselves and we're not, you know, in tune with our body and we're not connecting to nature and we're not, you know, compassionate to our fellow human beings and to, you know, animals. And then we're not actually learning the lessons of what it is that we're trying to experience, which is honestly, I think, connection to self and to the world around us.
I've seen people do these profound experiences, such as Vision Quest, or they come out of an ayahuasca ceremony and they've had this huge realization and awakening. And then, like a month later, it's like they never went. And so, what is the integration piece of it? Like, how do we get the most out of our experience? Or why is that happening where we have this huge, profound awakening and realization, and then 2 weeks later, it's like gone, or a month later, it's just slipped out of our hands?
I mean, I think that the way we live our lives, especially in this modern era, we're very disconnected from each other, from ourselves. And I think we fall into these patterns, these traps very easily, where we have these big, expansive, beautiful, insightful experiences, and then we're not taking the time to actually integrate them into our life to learn the lessons that are being shown to us. And so, you know, I can't speak to everyone's individual experiences, but I think knowing what is required for you to integrate your experience, I think is one of the biggest, most profound lessons of using any kind of experience like psychedelics or a vision quest or these like big revelatory aha. Like we go on a trip somewhere and we have this amazing experience and we connect to things that we've never connected to before. And then we come back in our day to day and it doesn't stick. And so, you know, what are we abandoning? What parts of ourselves are we abandoning in kind of re-entering our lives? And, you know, what is the deeper work that needs to be done?
So let's talk about how the brain lights up, because say we are in a psychedelic experience, our brain lights up and all of the different parts turn on. And then we always talk about the psychedelics create new neural pathways. So I really want you to explain, like, what does that really mean when we're saying that? Because we just say it and we understand it kind of. And what I believe is that when we practice some of our teachings that we've learned in those journeys, then that's creating those neuro pathways too, right? So that we can create stronger connections outside of the medicine. So can you talk about that piece?
Yeah. So that's, there's a lot of science in this. And I think I'm just trying to boil it down to what's going to be useful to discuss. So the kind of short answer to that is that when we take these classic psychedelics and even an MDA, which is not a classic psychedelic, it's works through a different mechanism. The end result essentially is increased glutamate in the brain. So there's two main neurotransmitters in the brain: GABA, which is like your stop, like you slow down neurotransmitter, and glutamate, which is your go excitatory neurotransmitter. And we have lots of glutamate in our brain. It's the most abundant neurotransmitter in our brain. And there's all these different circuits and neural pathways that increase glutamate. And one of them is serotonin circuitry. And so the 5-HT2A receptor, which is what DMT and mescaline and all of these classic psychedelics, LSD, MDMA, does that plus some other things as well. It triggers this excessive serotonin release, which then increases glutamate.
Mhm.
In the presence of large amounts of glutamate, the brain responds by increasing what we call brain-derived neurotrophic factor, BDNF, and that's like fertilizer for the brain. And so, they talk about what fires together wires together.
Mhm.
When you are firing all these different neural pathways that don't normally light up together, and all
Mhm.
of a sudden now there's this increased interconnectivity
Yeah.
between parts of the brain that normally don't fire together, there is an opportunity for that BDNF, that growth factor, to actually increase the connections of our neurons and link them to new neural pathways. And so, um, the basic neuron is what we call a dendrite, and so it's like a tree. It
Mhm.
has all these branches, and all those branches connect to all these other branches.
Mhm.
And what we have is this, like, they call it spinogenesis, where the spines of the dendrite, they actually can increase in size and in number, and the
Mhm.
strength of those synapses between them actually increases as well. So if you think about the branches of a tree and you pour a bunch of fertilizer on them, all of a sudden there's a bunch more branches, and those branches then connect to all these other neurons and all their other branches. And so
Mhm.
you're really creating this network where they're all then communicating. It's almost like a mycelium network,
Mhm.
where all these things are communicating with each other, and now they can share what's in their network and share what they have to offer. And so, how I equate this in like a practical term is, they talk about in like shamanic practices or even in some therapeutic modalities, this idea of like retrieving parts of self, or like soul retrieval,
Mhm.
like bringing in an inner child piece of yourself back
Mhm.
to yourself. um, and there's the pain that exiled or damaged or you know traumatic part carries, that you have to kind of welcome back in. But with that also comes all of the gifts and all of the other beautiful things that part's been holding. So people who've been traumatized in their
Yeah.
life often are missing parts of their memory. They're
Yeah.
missing parts of their childhood.
Mhm.
And when either through therapy or through psychedelic experiences, get in contact with that trauma, that
Mhm.
traumatized part, that traumatized memory. In EMDR and in the AIP model, they call this the pathogenic memories. And so these memories that are been stored away in our brain, and we could talk about what parts of the brain they typically get stored in or kind of quarantined off into. Um, when those get activated and then get hooked back up to broader networks of the brain,
Mhm.
they can bring back with them
Yes.
memories of your childhood.
Yes.
So they bring back experiences that you forgot you had when you were a
Mhm.
kid. And sometimes they bring back this playfulness or this creativity or this lightness or these parts of ourself, these parts of our childhood that we abandoned or forgot.
Mhm.
And so even though there's pain that comes back with re-experiencing and reactivating that piece, there's all these beautiful gifts that come with it. And
Mhm.
so I think that's sort of the way I would characterize the subjective experience of what I'm talking about on like a neurophysiological level.
Yeah. Yeah. I mean, that's what I love about EMDR is that people lose chunks of their childhood and they won't remember it. And then when we work with the trauma, then they can think about the trauma without their nervous system getting reactivated or activated. And all of these positive memories that they had forgotten flood back in. So I would like you to go into what happens to the brain with trauma. And so let's just go with uh I'm making this up, but say I'm 7 years old and I'm in the backseat of a car and I have this hellacious we get in a hellacious car accident and my mom's hurt and I feel like she's going to die in that moment and I'm not feeling safe. So in that example, let's break that down about like what's happening in that 7-year-old brain.
Yeah, so I think this gets into a lot of like the theory of trauma and how the body and the brain and the psyche deal with traumatic experiences. And most of the time, and there's a lot of different people who talk about this from like a theoretical standpoint, there is that part of yourself actually is like dissociated
Mhm.
or kind of like removed from your experience so that
Mhm.
it's not injured. And so really big trauma like that actually causes this like split or like disconnection to that part of ourself to
Mhm.
protect ourselves so that we don't have to go through the pain of what's going on.
Mhm.
So, a lot of people will talk about when they have something really traumatic where they actually like are outside their body and they can see themselves
Mhm.
going through the traumatic experience, but they don't feel the pain of the experience. That's a protective mechanism. That's actually like our brain, our body doing what it knows how to do to protect ourselves.
Mhm.
But the kind of the consequence of that is that that memory, that experience doesn't actually get processed in an adaptive way. So it gets kind of quarantined or sectioned off.
Mhm.
And this kind of gets a little bit into the theory of like the laterality of the brain, where the right brain is more emotional, creative. It has more of those sorts of major networks, and the left brain is more of our rational, cognitive. It's our language centers. It's math and science. It has more of that kind of logical approach to the world.
Mhm.
And so there are networks of both of those things on both sides of the brain, but the largest areas are on the right side have to do with that kind of like ability to be expressive and be emotive. And our speech, language, cognitive, narrative section of our brain, our logic, is on the left side.
Mhm.
And so traumatic experiences tend to get trapped in the emotional areas of our brain, so on the right side.
Mhm.
And they also get trapped in our limbic system, so like our midbrain, our emotional brain, our quote primitive brain,
Mhm.
right? And so I think what ends up happening a lot of times is when we are doing like therapy, a lot of like Western and modern day therapy is very top down. When I mean top down, I mean like we're trying to approach it from a cognitive or like rational level where we're
Mhm.
using language
Yeah.
to trying to retell our story and try to access these emotional parts of ourselves. And what they've found is it's called the Rebus model. Under psychedelics, it's called relaxed beliefs, relaxed belief under psychedelics. It's this idea that we kind of have this they call it entropy, or like parts of our brain that normally work well turn off. And so we have this lack of top-down processing, and we really are experiencing it from a bottom up,
Yes.
which is more to do with like our somatic experience, our
Mhm.
physical experience, our emotional experience, things. So our amygdala and our like our emotional brain, our sensory brain is
Yeah.
that midbrain, right? So the
Mhm.
way we experience the world without words
Yeah.
is in that midbrain. And so they talk about the body keeps the score.
Yeah.
You've probably heard that a lot. We store traumatic memories, we store experiences, we store wisdom in our body. And if we try to approach that from a top down perspective, we don't really get access to it. But when we come from the bottom up, that's when stuff starts to boil to the surface. So
Mhm.
the other part of this is called the HEALS theory, and it's some neuroscientists are thinking and observing that psychedelics are predominantly a right brain experience. And so we're activating those, so it's bottom up and right to left
Mhm.
experience. We are processing these quarantined, sectioned off, isolated memories um, and linking them up to this broad network of our brain because the whole thing, remember, is lit up at the
Yeah.
same time.
Yeah.
And so the way that the AIP model is developed is that we're actually um, activating something and then we're trying to link it up across the laterality as well as bottom up or top down processing. And so we're trying to link up these isolated, dysfunctionally stored experiences to healthier, wider networks of our brain. And this is how we integrate experiences that have been really difficult that we don't have maybe the words or the understanding for.
Mhm.
So a lot of like pre-verbal trauma is also stored this way in the right brain, the emotional brain, and also in our somatic brain, our midbrain.
Mhm.
So it doesn't have to be based in language. And so a lot of what therapy tries to get at from a top-down perspective is to create the narrative or to rewrite the narrative of our experiences so that we're cognitively processing things or reprocessing them. But I think there is bigger opportunity in processing something from like a somatic or an emotional perspective. You don't actually have to have the language to understand it. It can still just be processed. And that's what
Mm-hmm.
psychedelics kind of give us the opportunity to do.
So we're feeling everything more in our bodies. So in that example, if that 7-year-old was going to go work on that trauma, then instead of trying to figure out like, why am I'm an adult, I know I'm safe, and I know that that's rational, and I know that my mom's fine. I would go into that experience and I would feel what it felt like in my body, and feel that unsafety, and feel that discomfort, and feel that, and then slowly be able to put the language and the words to it, so that when I look back at that experience, and it's not that quick, but when I look back at that experience, I can think about it without my body being reactivated and holding on to that trauma, and figuring out a way to like release the trauma out of my body. Maybe it's through tears, maybe it's through shaking, whatever that might look like. And so it is what, from what you're saying, it's that inward reflection too that needs to happen. And then maybe after that experience, just continuing to say to myself, I'm safe, I'm safe, I'm safe
Yeah.
now. Um, to build that neuro pathway of safety in my body, right?
Yeah. And I think there's also one of the things that we ignore is the wisdom of our body. Like our body has a story to tell as well.
Mm-hmm.
And so if we're trying to access this body story through our brain, we're not going to get to it. And so this actually speaks to a little bit of this body mind separation that happened in the age of enlightenment, age of reason, right? 17th century, Descartes says, I think, therefore I am. So
Mm-hmm.
this entire focus that we're paying to our thoughts
Yeah.
being the most important thing, and that's how we know who we are and what we are. It's what what we are defining as consciousness.
Mm-hmm.
And I think there's a whole other body of wisdom that is in our physicality, that lives in our emotions. I feel, therefore I am, right?
Mm-hmm.
There's just a being, a presence.
Mm-hmm.
Like we lost the ability to connect to that. And I think psychedelics turn that part of our brain off,
Mm.
that very left-sided, dominated,
Mm-hmm. Logical.
top-down, dominant, logical, right? Right. We're not trying to
Mm-hmm.
use that lens
Mm-hmm.
to work with ourselves on an internal level. We're actually using deeper wisdom, deeper, more kind of almost like essential experiences of what we know is true about ourselves
Mm-hmm.
to then work through traumatic experiences, um, disconnection with ourselves. We're actually kind of, I think, almost like going back in time to a place of where we were more in tune with ourselves. We've lost the ability to really do that unless you're like a yogi or you're like a athlete or you're someone who like really knows their body and knows the internal experiences of their body and knows how to listen to their body. Someone who does tons of meditation and uses practices that are embodied, not about just transcending your physical experience, but
Mm-hmm.
really working deeply inward to understand what's here and how to access it and how to work with it, right? We've lost the ability to really connect to that.
Mm-hmm.
And I think psychedelics bring us back into that space where we were in tune with our environment, we were in tune with ourselves, we were in tune with other people. We had
Mm-hmm.
just a different way of going about the world, and we had a different intuition and wisdom that we used
Mm-hmm.
to see the world. And I think that that's one of the beautiful gifts of psychedelics. Not that you
Mm-hmm.
can't do that with other practices, but it is one of the things that psychedelics can do for us.
Mm-hmm. So if we're picturing the brain that's in the resting state, and then we're picturing a brain on psychedelics that's all lit up, after that psychedelic experience, the next day, where's the brain? Is it back to is it back, or are there like a few more things lit up, or are you saying that we need to create those neuro pathway, like we have opportunity there to create stronger neuro pathways, or like how long is that window open? What do we do with that window?
I don't know if anyone knows exactly how much time you have.
Mm-hmm.
I think what's starting to come out in some of the like people who are running ketamine clinics and their like anecdotal experiences, as well as maybe some of the literature is starting to just suggest that there's like this kind of golden window for integration after a ketamine experience where the brain is plastic,
Mm-hmm.
where the brain is firing in a way that it doesn't normally fire, where you have the opportunity to really kind of strengthen and really kind of create this foundational network that's
Mm-hmm.
different than the way you've been usually using the brain or usually thinking about something. So, you talked to Devin on your podcast about integration after a psychedelic experience. And
Mm-hmm.
we have these big expansive experiences and then we go right back into telling our old story
Mm-hmm.
and talking about the things that happened to us, and with that same either like victim mentality or powerlessness, or we're reinforcing the negative experiences rather than reinforcing the positive experiences or the insight that we gained, right? Like there is this opportunity in that window, however long it lasts, days, weeks,
Mm-hmm.
months. I think it's different for everyone. It's different for every experience,
Mm-hmm.
where we have an opportunity to maintain the insight and the perspective that we gained under the medicine.
Yeah. Yeah. That's the key. That's the key because we can have all of these insights and all of these wisdoms that come to us in a psychedelic journey, and then we can do nothing with it. But say, like one of the things I'm working on now that I've discovered is when I'm playing with the archetypes is how we all have the victim archetype, but how I fall into that victim and the language that I'm using. And so I had um a deep experience where I was sitting in my victim for a really long time, and then the integration piece is, okay, what do I do with this? Oh, it's popping
Mhm.
up again. What do I need to do? How can I change this? How can I transmute it? And then it pops up again and again. And these are opportunities for us. And I think what I've noticed with medicines, psychedelics, plant medicines, is that it gives you that opportunity, and then the integration's really the hard piece. It's where I tell everyone that's where the work is. The journey's kind of the easy part, although it's not easy, let's just face it, but it's not easy, but the integration is the test. And it seems like the bigger the lesson is that comes into that journey, the harder the test is. It's like you get out and it's like, oh, you think you learned that lesson? Well, we're going to throw you the biggest wrench and we're going to see how you handle it. And either you can go back the way you were doing things along before, which is easier, maybe not painful or comfortable, but easier, or you can do it a new way, this way. It's like breaking, like once we see patterns of codependency, okay, well now we need to break those patterns of codependency. Or maybe we see the archetypes showing up in our work and we see that that's dysfunctional, and then it's like, okay, well that's great, now I saw it, now I have to go to back to work and I have to make these changes, or I have to use my voice. Now I'm using my voice, now I'm expressing myself, now I'm expressing my needs. And so that integration piece is so difficult and so important and can be skipped over so easily. And I just think that that's where all the work and all the magic is.
Yeah, I think what I've come to realize is that what's more important than the psychedelic experience is the sober practices that you have in place outside and around these experiences. Because if you don't have a solid framework for doing this deep self work, if you don't have a community that you can lean on, if you don't have those things in place, it can be very difficult to integrate what comes up in a psychedelic experience. So, because we are activating these pathogenic memories, right? These things that have been dormant in our system for a long time. Things can come up that we don't understand and we don't have a context for working through. And so psychedelics can actually be very damaging in that it brings up stuff that we may not be able to handle. And so we have to have, a therapist, or we have to have people we can talk to. We have to have our own self practice. We have to have ways in which we can reprocess and integrate the things that come up when we're doing these large
Hmm.
kind of like soul revealing
Yeah.
experiences, right? Like not everything in our soul and our spirit is pretty to look at. Not everything in our physical experience is something that we want to re-experience, right? So we have to be prepared for that other stuff to come up as well. It's not just about feeling God and oneness. There's also, deep, heavy things that are part of what it is to be a human being. And we
Mhm.
have to know how to
Mhm.
work with them. We have to know how to hold them gently with compassion and bring the healing in that's being asked for.
Mhm. I still believe that one should not pursue therapeutic psychedelics until they're ready to walk through the fire. I think um that you don't have to be perfectly stable. I think most people, when they go into those medicines, aren't perfectly stable, and that we're looking for healing. But I think that um, you need to be ready. You need to be ready to do a lot of hard work. You need to do a lot of self reflection. You need to be ready to walk through the fire. You need to be able to lean on your support systems and have a support system. And so you and I saw when we went to Peru, there's a lot of people in Peru doing a lot of different medicines that are being offered. And some people fly in, especially from the US, they'll fly in for a week. They've never left the country. They've never been in Peru. They've never, left the United States. They go there, they do a whole bunch of medicines. Their minds are blown. And then they go back to work on Monday and they don't have a community and they don't have people to talk to. And I just had somebody reach out to me that had a horrendous experience in Peru that's looking for support because they can't integrate their psychedelic journey. And these journeys sometimes are massive, 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 massive. Not always, but they can be, and they can be really destabilizing. And they can be really beautiful, and they can be all of that. They can be destabilizing and beautiful. But
Yeah.
I think it's important to be ready for that. If you're going to walk through that door, be ready for what might come up. And I always thought, well, you're not going to get dealt more than you can handle, but I'm seeing that that's not true, that you can be dealt more than you can handle sometimes. And so having a therapist or having a community or having somebody that's willing to listen to the craziness of it, because psychedelics are a little crazy, and so maybe a traditional therapist that isn't versed in that would not handle that as well as a therapist that understands the psychedelics. But really important to have people to talk to, whether it be a spouse, a friend, a therapist, a community. Somebody needs to hold you through that journey. And it's not that you can't do it without support or not being held, but it no, maybe you do. You do need it. You do. I don't think you could do it alone. You need a tribe.
Yeah. And I think that that's one I think is the biggest lessons from walking the path with any kind of psychedelic or plant medicine is that you realize how much we are interconnected. You really realize like the power of community, that experience of the collective consciousness is actually one of the most beautiful and kind of primary lessons of psychedelic medicine, right? We're all one, we're all connected, we all are interconnected, we all rely on each other, we're all, what we do affects everyone around us, it affects the world around us. If you don't have that already in place, it's going to feel very isolating when you go and have this beautiful, expansive, connected experience, and then you go back to your life where you're isolated and you're alone, you're disconnected.
Mhm.
I think that can be also really jarring and really potentially very damaging.
Well, and it could be that you've been in a relationship for 20 years and you realize that that relationship is abusive or dysfunctional or doesn't
Right.
serve you, or same with your friendships, like certain friendships need to change or your work needs to change. And so when you have that realization and then you put it into action, it can be destabilizing to, okay, I'm going to change careers, or I've been with this partner for 20 years. Obviously, if you go into the medicine and your relationship is stable and good, like you don't have to worry about that, obviously. um, but if you're having a lot of issues, then the medicine might reveal to you that that's not right for you. And so that's why the community is so important. That's why the integration is so important. That's why the work begins after the journey.
Yeah, and I always, I tell people that the journey isn't the thing itself, right? Like taking the medicine isn't the thing itself. It is
Mhm.
a tool or a vehicle toward the thing itself, which is
Mhm.
the work. It is the integration. It is the practicing what you've learned. It's walking
Mhm.
your path. It's taking those steps, right? It's not just turning off and numbing out in your day to day and then going and doing a psychedelic experience and having this incredible, and then you just go back to being turned off and shut down and disconnected and,
Mhm. Mhm.
dissociated. Because that's then what are you doing? I mean,
Mhm.
to me, that makes no sense.
And so right now you're going back to school again, to get to get your psych NP, to get people off of traditional Western medications using psychedelics. And so, what makes you think that that's possible, and how are you looking at that lens?
That's a great question. I think what most medicines that we're using in the mental health space are trying to achieve is this neuroplasticity, or this sort of increased activation of parts of the brain that are maybe malfunctioning. And a lot of those work through serotonin, dopamine, and norepinephrine. Those are kind of the main three neurotransmitters of the brain that we are working with. Um, and most of those are related to depression, anxiety, um, ADHD. And so psychedelics work through very similar mechanisms to actually increase all of those neurotransmitters. And what they do is instead of doing like microdoses that are like kind of like maintenance therapy, they do these like macro flooding of the system that actually changes and remodels the brain. And so one of the ways that SSRIs actually work is through this like neuroplasticity, because they don't work by increasing serotonin. They actually change the way that the brain is firing through kind of remodeling or this neuroplastic effect, which actually takes a couple weeks to see the effect of. And so it's great while you stay on it, but the minute you come off of it, you go through a lot of times they call discontinuation syndrome, where often your symptoms that you were taking the medicine for initially get worse.
Mm,
And so it's not something that's actually permanently changing your brain. It's like maintaining a status quo, which might be important for somebody. That might be what they need to be on. And I'm not saying that people who are on SSRIs should come off of them,
mhm,
but what I'm saying is that understanding why they work, how they're working, and if that's something that's right for you. If
mhm,
you don't want to be on them for the rest of your life, then what can you do to try to get off of them? And maybe that's, psychotherapy. Maybe that's doing psychedelic assisted therapy. Maybe that's, meditation. Maybe that's other things that allow your brain to adapt and grow in the ways that the medication is kind of like just kind of putting a band-aid on.
mhm,
And so symptom management, I think, is what a lot of mental health has become, rather than actually looking at what is the foundational root of someone's mental disease, right?
yeah,
Um, and so it's really complicated. I don't pretend to have the answers, but I think that people who are wanting to look at this work in a different way, who are wanting to look at themselves in a different way, and are wanting to come into like a real sense of wholeness and connection to themselves, psychedelics are one of those ways in which you can really do that work
mhm,
on a very deep and meaningful level that maybe allows you to come off the medications that you're on to just make yourself feel better.
mhm, yeah, beautiful,
So,
yeah,
yeah, I mean, I think there's a lot of what's happening in the mental health field is looking at how psychedelics can be used therapeutically, and what they're finding is that the results from them for anxiety, for treatment resistant depression, for end of life transitions, people who are dying from like a terminal illness, are using LSD in those spaces, they're using psilocybin in those spaces, and really helping people move through the grieving process, the transition to death.
mhm,
They're using them for PTSD with MDMA specifically. Ketamine's a beautiful medicine because it plays very well with other psychiatric meds.
mhm,
It doesn't have as many interactions as other ones do. And so, um, really looking at like, eating disorders, OCD, there's a lot of different mental health diagnoses that are um, finding their place in the psychedelic medicine. And so, in the next couple of years, hopefully, we're going to see psilocybin become legalized. I think we're probably a couple of years away from, MDMA being put back on the FDA board for approval.
mhm,
I think we're, 5 to 10 years away from LSD, maybe. Like ketamine's already legal. I think we're going to see its use expand greatly. Hopefully, we'll see insurance starting to cover it. Like this is really the sort of renaissance of psychedelics and how they're being used in the mental health field. And so knowing that what we're talking about isn't just symptom management, but we're actually talking about healing, bringing people into a place of like deep healing and wholeness.
Mhm.
That's a space I want to be part of. And so
Yeah.
this is why I'm switching my career for the third or fourth time now.
Mhm.
Sorry, honey. Um, but I really feel like it's an opportunity to work with people in a really deep and meaningful way where I'm actually hoping to empower people and bring them into a space of connection with themselves where they don't need medicines. They don't need, mental health providers to kind of temporize them,
Mhm.
and they can find their own sense of self, of wholeness, of health, of well-being.
Mm. Beautiful. Yeah. All right, Adam, thank you, thank you, thank you. If people want to reach out to you, they can reach out to me and I can connect them with you. Just wondering if you have any last words of wisdom.
I think, there's so much coming out in the literature that's super exciting, and I think just kind of keep an eye on it. Every year there's like dozens of articles that are coming out with super exciting research. And so I think staying on top of that and really looking at how it's being used clinically and from like a real rooted scientific basis is going to be super important, because I think, everyone anecdotally is like, oh, psychedelics are amazing. And yes, they can be. I think what we're actually seeking now is that robust understanding of how best to use them. And
Mhm.
so I think we'll get a better idea of kind of how to responsibly use them in a science-based approach in the next, hopefully 5 to 10 years.
Yeah. Yeah.
Mm.
Well, thank you for sharing your wisdom. It was a pleasure having you on again. And if people want to catch, we
Yeah.
did a 3-part series on the science behind combo and our experience using combo in the jungle. And combo is a non-psychedelic, beautiful amphibian medicine that you and I play with. People can check that out. But thank you, thank you, thank you. It was great to have you.
Yeah. Thank you.
Thank you for listening to the Connected Community Podcast. If you enjoyed today's episode, please like, share, and subscribe. I can be found at www.nickyyoga.com, NICKYYYOGA.com. Until I see you again next week, I hope you have a beautiful day.